Welcome, Martine Polanco, Dr. Martine Polanco. Thank you so much for being here with me. Appreciate it.
Yeah, thanks, Kim.
Yeah. Yeah, I'm sorry you couldn't make it to Philadelic, but that's what the magic of Zoom is for. So thank you. And we got a chance to dive into some really great things on the panel. There was only 40 minutes and it flew by so fast, and there was still a good 60% of the questions I didn't get to. So I figured I would let you share a bit about the mission within, and Zach did a great job sharing on the panel. But if there's anything, I know that you came from some former spaces, you were at Crossroads before, and I'd love to know how Mission Within came about, and then we can kind of dive in a little bit more.
Yeah, sounds great. So I've been in the Ibogaine space for about 25 years. Initially, I got in trying to help a family member. And when I saw what this did for her, I decided to dedicate my life to make it more available. Because back in 1999, when she had her treatment, there wasn't a lot of options, especially not medicalized treatment. We went to Florida to do it with an underground practitioner, and she had a great experience. So I I just saw the potential and the need for it because there was a lot of addiction in my high school. So I saw people going down the wrong path and not being able to kind of get out of it on their own. And usually it was like the smart, creative kids that ended up using hard drugs, whereas the less smart kids, they just drank alcohol. I guess it has to do with curiosity and just wanting to kind of explore their consciousness. And the first 15 years, like on and off, I was working doing opioid detox. So I was working with uh, heroin addiction, which is what was mostly prevalent back then. Then the OxyContin epidemic started, so a lot of people were using pain pills as well. And I did that under different clinics. Uh, Crossroads was the latest clinic. That one existed from 2012 to 2017. And then we pivoted and started the Mission Within. The Mission Within was an effort to treat veterans. And we initially started treating veterans in 2015, and they were coming in for opioid addiction, but they reported after their treatment that their PTSD was gone. So that was really intriguing to me because in the West, we don't have anything that actually cures PTSD. And that's what they were reporting. They were reporting that their symptoms were completely gone to the point where they no longer met the diagnostic criteria for PTSD. So we actively started looking for veterans, and I got connected to a Navy SEAL doctor and told him that this could help his friends. And that's how the veteran program got started. And in 2017, we closed down Crossroads and opened up the Mission Within. So it's an outgrowth of the previous work, but focused more on veterans. It started off slow, like all these efforts do, maybe one person a month, and they would then refer friends. So it started picking up to, the point where we're at now, which is, 4 retreats a month and booked out, 5 months in advance.
Amazing, amazing. It was shocking to me. I spoke with some folks when I lived in the South of America, and in like Tennessee and places like that. And someone told me, we've been sending our Navy SEALs down to Mexico to clean them up for decades. And I was like, what? I had no idea. And you got on my radar then. That was 6, 7 years ago. But it's just amazing that this has been used so effectively for so long, and it's just barely coming on the radar of the American public, and it's incredible. Do you feel like it's appropriate for us to attempt to put it into the medical system of America?
Absolutely. I think this is a treatment that not only works for PTSD, but for mild traumatic brain injury and neurodegenerative conditions. So it works where nothing else does. There has been no innovation in traumatic brain injury treatment for the last 60 years. In fact, some of the treatments that are being offered by conventional Western psychiatry make things worse. Like if you take somebody that has a traumatic brain injury and load them up with sleeping pills, with Adderall, with psych meds, they will, in the long term, get worse because it's not addressing the underlying issue, which is neuroinflammation. So their brains are inflamed. And you have to address that through a functional medicine approach, and then also Ibogaine helps with that as well. The way that I see this is, entering the system, it has to be a medicalized approach. So it's almost an inpatient procedure that requires medical supervision, similar to surgery. So I think that's what it's going to look like. It's not going to be a shamanic uh, treatment. It's a medicalized treatment.
What does it look like when folks are with you at the Mission Within? Are they in a like clinical setting, do you feel like? Are they on a hospital gurney? Are they, what's the environment?
So it's not a hospital gurney. It is a kind of a normal mattress, but they are hooked up to an IV. So they have an IV port in their arm that we use to administer magnesium sulfate, which is a prophylactic treatment to avoid arrhythmias. They also undergo a lot of screening beforehand. So when they arrive, we take them to a cardiologist who does an EKG and also an echocardiogram. An echocardiogram is an ultrasound of the heart that looks at structural issues. And then the EKG looks at the electrical conductivity of the heart. He then writes up a report. He clears them for treatment. We do lab work to look at electrolytes, liver function, kidney function. We also do a urine drug screen to make sure that people are not on any illegal drugs that might increase the risk of arrhythmias. So if somebody pops positive for alcohol, stimulants, opioids, or they didn't declare that they were on benzos, then that's a red flag for us. So we have to often turn people away that are popping positive for substances.
Yeah, it was really interesting at Philadelic that, people were a lot of theoretical and discussions about there's definitely what has been deaths, there's associated linked to Iboga and Ibogaine.
Mhm.
But what was really striking was a lot of it are reports from not people in the room, people, everyone on the panel that we did, there was not a single death in Dr. Bruno's work, 30 years, your work with Patrick and Michele Fishley, Dr. Carlos Alvear is aftercare, but still administering boosters. It can be safe. I think we need to take the approach that you guys are taking, and that's what the whole point of the panel was, and why I'm so glad to talk to you, because you need to have these parameters and be willing to turn people away.
Yeah, absolutely. And so for the mission within the 1,500 veterans that we've treated, we haven't seen any kind of adverse cardiac events. When I was doing the addiction work, there were some issues that would come up, and I would say 1% of people would require some kind of medical intervention. uh, Whether it's, they're purging to the point that they need hydration, or they have a chronic pain condition that suddenly manifests because you're taking away the opioid and you have somebody screaming in pain. We've seen seizures, we've seen people vomit blood. There's like a lot of different issues. There's also the risk that when somebody uses right after Ibogaine, which is a temptation that they can overdose. So in my previous work, I did have some adverse events that came up. And it's part and parcel of working with addiction, unfortunately, that people do die on their way to rehab, die during rehab, or can die after rehab.
Yeah. Yeah, and I think that speaks to understanding the nature of addiction and the nature of what we're dealing with, and having experience in the space to recognize, it is challenging. I also work with the addiction community, so I understand that, it's not a personality flaw, but it's a survival technique to lie about what's happened, what's happening. It's just how they've gotten by. And so it's not to shame them, but to say, this is part of it. And that it's especially because this is being applied to the opioid crisis. It's something to keep in consideration, and understanding and learning from you guys that have been doing it and understand what to look for.
Yeah, exactly. And that saying, trust but verify. So, we search people's bags, we have to go through their belongings. And yeah, sometimes we do find medications that have not been kind of declared, and then we can have a conversation around it. But like you're saying, it is kind of like the initial natural impulse to lie because that's the survival mechanism and
Yeah.
something that's necessary. And they really want the treatment, so they will say whatever the provider wants to hear.
Yeah, yeah. It's to be understood in the grander scheme of things as well, to just recognize that it's part of this circumstance. And it's not that these people don't deserve treatment. It's that there's just things that we need to keep in mind when working with that population, because that is where it is aimed. However, I know that you are looking and have worked with TBI, PTSD, autoimmune. Do you guys ever address autoimmune there?
Not specifically. I mean, we have seen some good outcomes when people report that their other conditions like chronic pain syndromes or autoimmune conditions get better. We have treated also some patients with Parkinson's. We've treated a couple people with ALS.
Mhm.
And it's hard to tease apart like what's the mind and what's the brain, because once their stress goes away, their symptoms get better, right? So is it that their PTSD is gone and now their cortisol is lower and that's why they're feeling better, or is it like actual physical healing? I think it's both. Like you're getting both effects, but there hasn't been any clinical studies on neurodegenerative conditions that we can point to and show people the data. It's all anecdotes at this point.
Just for those that didn't see Zach speaking about Mission Within, you serve Ibogaine derived from Vacunga, correct?
We have Ibogaine derived from Lacanga, correct? Yeah, we have also used Ibogaine derived from Iboga. Yeah.
And then you also serve 5-MeO-DMT at the end, correct?
Yes, which is an optional treatment, but a lot of people have decided to do that experience as well, and they get a lot of benefits out of it.
Gotcha. Could you share a little bit about the phases of what happens during an Ibogaine experience? I know that, and everyone on the panel as well as you have all experienced this medicine, so you can speak about your own experience, but also just there's a lot of trip reporting in this space, and people sharing what the experience of psilocybin and ayahuasca and all these, but it's still a little nebulous with Ibogaine. So if you could share just something that you typically see, and then also some things that maybe were surprising, but I mean, you've seen a lot of people, so there's some incredible non-scientific and non-repeatable experiences that we can track, but you can just share from your own experience working with people.
Yeah, so the Ibogaine does have distinct phases. Like the first one is a phase of visual hallucinations where people have these dream-like images come up in their mind's eye that are mostly autobiographical and generally related to experiences that they had in early childhood, so before 10 years old. Very much like a dream, there can also be some really bizarre imagery that's like not related to your own experience or your own life. We have had people that experience wartime visions even though they've never been to war. So I think they're picking up information from the collective unconscious where there's this shared field of experience that humans are going through, and we can tap into it with the Ibogaine. It's important to note that only 70% of people have this waking dream state, and a good 30% get no visions at all. It's just that people read trip reports online and they come in with very high expectations of, meeting their dead relatives or, being able to address, childhood trauma, and then they get a blank screen and nothing comes up and they're disappointed because, quote unquote, it didn't work. But it is working, especially if you're coming in for a traumatic brain injury or for an addiction. It's having a neurological reset effect. But for the people that do have the waking dream state, that generally lasts anywhere from 6 up to 12 hours. And then the visions or the visual hallucinations, they subside, but the person is still in a state of stimulation. So they're thinking about what they saw, they're processing what they saw, and this can last up to 20 hours. During that time, it's very hard to fall asleep. But after that stimulation phase, they're able to get some sleep. Usually, like it's a short period, like maybe 3 hours. And when they wake up from that, they feel completely refreshed. So it's over. But it's a good 2-day commitment. It's not like a mushroom journey where it's 6 hours. This is generally like 2 whole days of not being able to like navigate the world and function. You have to get help getting up because you get ataxic. Some people have to bring you food. You have no appetite, but as soon as you get some sustenance in you start feeling better. So that's generally kind of like the Ibogaine journey. And then after those 2 days, there's a 2 or 3 month window where the person is able to make changes in their life It's a window of opportunity where they can adopt new habits and they feel more positive. And this is driven, or the theory is that it's driven by the noribogaine. So ibogaine breaks down in the liver into an active metabolite called noribogaine, which is fat soluble, and it's released slowly over time. So the whole arc of the experience can be said to be like 2 or 3 months because of that long kind of residual mood elevation.
And do you send folks home with boosters or to other spaces with boosters?
We don't send them home with Ibogaine boosters. I mean, we sometimes recommend mushroom microdosing if a person is needing some kind of, you know, psychedelic support. I think with Ibogaine, it's a bit delicate because at least with the patient population that we work with, they take one booster, they feel great, and then the next day they'll take four because they assume that they're going to feel even better. And
Yeah.
then they're getting bradycardia and it interacts with medicine. So it's just a little bit risky to work with Ibogaine microdosing.
Gotcha. Gotcha. And when I spoke with Zach, he was sharing that you guys were exploring amino acid therapies as well. Can you share a little bit about that if you don't mind? Because I know it's off topic, but I think people to understand that this is not the only thing that happens. Just because you do Ibogaine or Iboga does not mean that that's the end of your journey. It doesn't mean that you're fixed, cured. That's the challenging thing in being marketing myself is there's a lot of false ideas. And once you've come out the other side, there's still a rebuilding process that is required. So I'd love to hear a little bit more about that.
Yeah, no, thanks for that. And it is, I think, a really important part of mental health is physical health and also metabolic health. So a
Mhm.
lot of what we're seeing as mental health issues are actually metabolic issues, and it's related to our diet, our food environment. And when you address those, everything else gets better. So when people start exercising, it helps their blood sugar and helps their energy levels. So everything is connected. So what we've been doing is we have some generous donors that have given us funding not just to treat people with ibogaine, but include functional medicine. So we're able to do comprehensive lab work and look at nutritional deficiencies. In the West, most of us are deficient in vitamin D or omega-3 or B vitamins because our food is no longer nutritious or as nutritious as it was before because of soil depletion. So you have to address these deficiencies because no matter how many psychedelics a person takes, if they're vitamin D deficient, they're just not going to get better because you don't have the building blocks of forming, the right neurotransmitters, or you're going to have just problematic manifestations in mood and learning and memory if you are not well resourced. So that's one piece. And then we're sometimes giving people peptides. So peptides are small molecules that can help with losing weight, building muscle, can help with brain function. And with the veterans that we work with, I would say all of them have mild traumatic brain injury just by virtue of their training. Like when you're using modern weapons, you're impacted by these blast waves that can rattle the brain and cause like micro tearing inside of the brain. And then this is leading to the psychological symptoms. And often this mild traumatic brain injury also leads to hormone dysregulation. So when we measure people's growth hormone or testosterone, it's going to be pretty low. And if somebody's hormones are out of whack, their emotions are going to be out of whack. So that's another piece. It's a hormone optimization that
Mhm.
can be done through supplementation, through exercise, but sometimes people do need hormone replacement therapy.
So it's very comprehensive and it's much bigger than just this one substance. I think that's what is it's the tendency of the media cycle and the news cycle is to look at the one thing that does the thing and it's very exciting. But the
Totally.
truth is you didn't become addicted in a day, you didn't develop PTSD in a day, even though there's many people who say, it's a single incident. Actually, no, it's not because I think many people of Waves and War, people witnessed, the concept that that's the documentary on Netflix, that most of these people went back into their childhood to discover why they wanted to go to war to begin with because of challenges back then. It's not a single day or event that created the issue or the issues, and the idea that it could be fixed in a few days is a bit of a fallacy.
Agreed. Yeah, and the integration of this experience is equally as important as the experience itself. I mean, I always tell people that it's almost like 70% of the benefit come after a journey, and it depends on your daily practices. So implementing a meditation practice or breathwork practice, physical exercise, movement, not just like aerobic exercise, but lifting weights is really good for brain health. And then, proper sleep, very important. And a lot of us are sleep deprived because of our habits, right? We're looking at our phones pretty late at night, or we're eating late. And then our diet, if you follow the standard American diet, I mean, that's just a recipe for anxiety and depression because it's like dysregulating your system and causing inflammation. So a lot of it has to do with psychoeducation and being disciplined and doing daily practices. And in many cases for the rest of your life, like you can't like rest on your laurels and just assume that you're going to continue to feel well. You have to actively work on it.
Sort of makes a little space for those habits to change, though, which is important to note because many people feel stuck, I think. And
Yeah,
it's not that it's going to dislodge you, but it's going to give you other options, which
for sure.
is beautiful, as long as you put yourself in an environment where you can have those options.
Yep.
Yeah. So, I mean, part of the Philadelic conference was looking at how this might be placed in the Western medical model. And I know that people stay with you for 5 days. Is that right? 5 or 7 days?
So they stay with us, yeah, for 4 days right now. And then in January, we're increasing the length to 5 days. We have also been referring people to other programs where it extends the integration, sometimes for even like 10 weeks. But yeah, I would say 5 days is the time that most patients get. Sometimes it's 4 days in Mexico, one extra day in San Diego. So yeah, that's pretty accurate.
And in terms of looking at this in a bigger picture, it is the desire of sort of the pharma model and the medical model to shorten treatment and make it more financially viable for all sorts of reasons. But if you had your druthers, where would you place the importance of this? It sounds like you said 70% is the integration process. How long should people really be seeing support? And like if there wasn't the financial constraints, what structure would you place this in?
Yeah, I mean, and when it comes to number of sessions afterwards, I mean, we work with licensed therapists that do the coaching, and it's called coaching because they work across state lines, but they are all licensed trauma-informed therapists. And we see the greatest benefits when people do 8 sessions in total. So it could be 3 before and 5 after, or 2 before and 6 after. But that then gets expensive, right? Like it's a big cost. And like you're saying, like, people are going to try to like cut that cost. But different populations need different level of support, right? Not everybody's the same. Some people might need a lot more than 8 sessions. So it's kind of hard to tell. So hopefully, we can get to a place where insurance pays for at least the therapy afterwards. I mean, that would be wonderful.
Yeah, I mean, we've got some time before there's any legalization, but at least viable, responsible, experienced access is incredibly important. If I know that because your mission is to work with people, I know that you work with other people, but to work specifically with veterans, is there any resources you can point people to find access to partial support financially or resources where they can help prepare themselves, prepare their families for when they come back? I know that Zach shared that you do prepare the families, but are there resources that people can look towards that can help them get ready for this?
There's a really great organization called the Hope Project, and this was founded by Allison Wilson, who's the wife of a Navy SEAL, and she works specifically with spouses to help them prepare for their loved one coming home. That's kind of where I would start. In terms of organizations that can help financially, I mean, there's some nonprofits that can help pay for treatment. There's some that work with first responders specifically. The woman's name is Angela Scudden. So she has a nonprofit that works with first responders, and then Heroic Hearts works with veterans. Mission Within Foundation works with veterans. VET works with special operation veterans. There's a lot of different organizations out there that can help provide a scholarship or a partial scholarship for this treatment.
Gotcha. Well, thank you so much. I really appreciate your time and your expertise. Truly, it's really valuable for people, I think, to recognize that this is not a add-on to their licensure in a week or month or some kind of training. It's really you have a number of years of experience working with this medicine as well as personal experience and a lot of years just being beside people, which is invaluable, truly. So thank you for what you've done.
Thank you, Kim.
Yeah.
Appreciate you
Yeah.
talking with me, and thank you for your time.
Absolutely. Yeah. If there one final question, if there was some way that you could have supported yourself to learn about this medicine when you were just getting started with it, other than and you shared that was with a personal experience and just witnessing its effect, people who are interested in being part of this movement, how would you have changed the way you learned about it and or really got to know it?
When I started, there wasn't a lot of resources to kind of train yourself in this. Nowadays, there are companies that provide training for becoming a psychedelic coach to help prepare people, help integrate people. Being True to You is a great organization that does that. Then there are others that work specifically with nurses and with clinicians and therapists. For example, the California Institute for Integral Studies has a certificate program. I wish those resources had been available 25 years ago, but they are now.
Yeah, awesome. Well, thank you again, Martine. And may this be just the beginning of sharing your work more. I think many of the people on the panel somewhat quietly just get to work, so I'm really glad to share it with a broader audience, and I'm sure the Philadelic folks are going to appreciate seeing your face as well.
Thank you so much, Kim.
Thank you. Have a great day.
You too. Take care.